Hello, class. Welcome to Flourish Nursing Academy. This is Tutor Godwin. We'll be discussing antibiotics. Antibiotic is from antibiosis, meaning against life. Substances derived from a microorganism or produced synthetically, sulfonamides and quinolones, to kill or suppress the growth of other microorganisms. Classification of antibiotics. Antibiotics are classified in several ways. On the basis of the mechanism of action. On the basis of the spectrum of activity. On the basis of mode of action. Mechanism of action of antimicrobial agents. 1. Inhibition of cell wall synthesis. Penicillins, cephalosporins, bacitracin, and vancomycin. 2. Inhibition of functions of cellular membrane. Polymyxins. 3. Inhibition of protein synthesis. Chloramphenicol, macrolides, and clindamycin. Tetracyclines and aminoglycosides. 4. Inhibition of nucleic acid synthesis. Quinolones. Rifampicin. 5. Inhibition of folic acid synthesis. Sulfonamides and trimethoprim antimicrobial spectrum. Antimicrobial spectrum. The scope that a drug kills or suppresses the growth of microorganisms. Narrow spectrum. The drugs that only act on one kind or one strain of bacteria. Isoniazide. Broad spectrum. The drugs that have a wide antimicrobial scope. Tetracycline and chloramphenicol. Misuse of antibiotics. Antibiotic misuse, sometimes called antibiotic abuse or antibiotic overuse. The misuse or overuse of antibiotics may produce serious effects on health. It is a contributing factor to the creation of multi-drug-resistant bacteria, informally called superbugs, antibiotic resistances, and cross-resistances. Antibiotic resistance is the phenomenon that the susceptibility of pathogenic microorganisms to antibiotics becomes lower or is even lost after the microorganisms contact antibiotics many times. When the bacteria show resistance to one antibiotic, they are also resistant to some other antibiotics. This phenomenon is called cross-antibiotic resistance. Mechanisms of antibiotic resistance. 1. Alteration of the target site of the antibiotic. One of the most problematic antibiotic resistances worldwide is methicillin resistance among Staphylococcus aureus. 2. Enzyme inactivation of the antibiotic. V-lactam antibiotics, penicillins and cephalosporins, can be inactivated by V-lactamases of the antibiotic out of the bacterial cell. Active transport of the antibiotic out of the bacterial cell, efflux pumps, as removal of some antibiotics, e.g., tetracyclines, macrolides, and quinolones. Alteration in the porin proteins that form channels in the cell membrane, e.g., resistance of Pseudomonas aeruginosa to a variety of penicillins and cephalosporins. General principles of antimicrobial therapy. Identification of the infecting organism should precede antimicrobial therapy when possible. The pathogenic microorganism. Susceptibility to antimicrobial agents should be determined if a suitable test exists. Factors that influence the choice of an antimicrobial agent or its dosage for a patient include the age, renal and hepatic function, pregnancy status, the site of infection, etc. Selection of antimicrobial agent. Empiric therapy prior to identification of organism, critically ill patients, organism's susceptibility to the antibiotic. Patient factors, immune system, renal hepatic function. Effect of site of infection on therapy, blood-brain barrier, safety of the agent, cost of therapy, Ideal antimicrobial agent. Have highly selective toxicity to the pathogenic microorganisms in the host body. Have no or less toxicity to the host. Low propensity for development of resistance. Not induce hypersensitive reactions in the host. Have rapid and extensive tissue distribution. Be free of interactions with other drugs. Be relatively inexpensive. Complications of antibiotic therapy. Resistance due to inappropriate use of antibiotics. Hypersensitivity, penicillin. Direct toxicity, aminoglycosides equals ototoxicity. Superinfections, broad-spectrum antimicrobials cause alteration of the normal flora. Often difficult to treat. Antimicrobial combination. Results of combination therapy. Additive, indifferent effect. The activity of two drugs in combination is equal to the sum, or a partial sum, of their independent activity when studied separately. Synergistic effect. The activity of two drugs in combination is greater than the sum of their independent activity when studied separately. Antagonistic effect. The activity of two drugs in combination is less than the sum, or a partial sum, of their independent activity when studied separately. Indications for the clinical use of antimicrobial combinations. Prevention of the emergence of resistant organisms. Polymicrobial infection. Initial therapy. Decreased toxicity. Synergism. Prevention of the emergence of resistant organisms. Decreased resistant Mycobacterium tuberculosis with combination. Reduction of V-lactamase induction with combination V-lactam agents and aminoglycosides. Polymicrobial infection. Intra-abdominal infection. Pelvic infection. Mixed aerobic and anaerobic organism. Initial therapy. Neutropenic patients. In patients where the nature of infection is not clear yet. Decreased toxicity. Decrease the toxic drug required for treatment and thus reduce the dose-related toxicity. Synergism. Enhanced uptake of aminoglycosides when combined with V-lactam agents. Treatment of enterococcal endocarditis. Ampicillin and gentamicin. Viridans streptococcal endocarditis. Penicillin and gentamicin. Staphylococcal bacteremia. Vancomycin and gentamicin. Treatment of Pseudomonas infections. V-lactam agent and aminoglycosides. Inhibition of sequential steps. CAT, sulfonamide with trimethoprim. Treatment and prevention of chronic urinary tract infection, typhoid fever, and shigellosis caused by organisms resistant to ampicillin. Inhibition of enzymatic activation. Disadvantages of the inappropriate use of antimicrobial combination. Antagonism. Increased cost. Adverse effects. Superinfections. Alteration of the normal flora, often difficult to treat. Classes of antibiotics. The main class of antibiotics is beta-lactams. Penicillins, cephalosporins, carbapenems, monobactams, macrolides and ketolides, aminoglycosides, fluoroquinolones, tetracyclines, and amphenicols. Penicillins. The penicillins are the oldest class of antibiotics. Penicillins have a common chemical structure, which they share with the cephalosporins. Penicillins are generally bactericidal, inhibiting formation of the cell wall. Penicillins are used to treat skin infections, dental infections, ear infections, respiratory tract infections, urinary tract infections, and gonorrhea. Types of penicillins. The natural penicillins. Penicillin. G. Penicillinase. resistant penicillins, methicillin and oxacillin, aminopenicillins, ampicillin and amoxicillin penicillin side effects, diarrhea, nausea, vomiting, and upset stomach. In rare cases, penicillins can cause immediate and delayed allergic reactions, specifically skin rashes, fever, and anaphylactic shock. Penicillins are classed as Category B during pregnancy. Cephalosporins. Cephalosporins have a mechanism of action identical to that of the penicillins. Interferes with synthesis of the bacterial cell wall, and so is bactericidal. Cephalosporins are used to treat pneumonia, strep throat, staph infections, tonsillitis, bronchitis, otitis media, various types of skin infections, gonorrhea, and urinary tract infections. Cephalosporin antibiotics are also commonly used for surgical prophylaxis. Cephalexin can also be used to treat bone infections. The first-generation cephalosporins. They possess generally excellent coverage against most gram-positive pathogens and variable to poor coverage against most gram-negative pathogens. The first generation includes Cephridine, Velocef, Cephalexin, Ceporex, Cefadroxil, Biodroxil, Duricef. The second generation cephalosporins. In addition to the gram-positive spectrum of the first-generation cephalosporins, these agents have expanded the gram-negative spectrum. Cefoxitin and cefotitan also have good activity against Bacteroides fragilis. The second generation includes Cefaclor, Bacticlor, Cefuroxim, Zinat. The third generation cephalosporins. They have much expanded gram-negative activity. However, some members of this group have decreased activity against gram-positive organisms. They have the advantage of convenient administration, but they are expensive. The third generation includes Ceftazidime, Fortum, Cefixima, Suprax, Cefoperazone, Cefobid, Cefotaxima, Clafurin, Cefotax, Ceftriaxone, Ceftriaxone, Rosifen, Cefdinir, Omnicef. The fourth generation cephalosporins. They are extended-spectrum agents with similar activity against gram-positive organisms as first-generation cephalosporins. They also have a greater resistance to beta-lactamases than the third-generation cephalosporins. Many fourth-generation cephalosporins can cross the blood-brain barrier and are effective in meningitis. The fourth generation includes Cefepime, Maxipime. The fifth-generation cephalosporins, used to treat MRSA, methicillin-resistant Staphylococcus aureus, penicillin-resistant Streptococcus pneumonia, Pseudomonas aeruginosa, and Enterococci. The fifth generation includes Ceftaroline, Teflaro, Ceftobiprole, Zeftera. Cephalosporins side effects: diarrhea, nausea, mild stomach upset. Approximately 5 to 10% of patients with allergic hypersensitivity to penicillins will also have cross-reactivity with cephalosporins. Cephalosporin antibiotics are classed as pregnancy category B.